Welcome to this Informed Dental Consumer presentation. I'm Dr. Beth Dorian. The purpose of this presentation is to help you understand why you have a toothache and what we can do about it. No doubt, toothache pain can be excruciating. Even though the source of the pain is a single tooth, the pain can radiate up to your head or along the entire jawline of the affected side, sometimes even the opposite side. The pain can also ebb and flow from day to day. Some days you'll feel okay, while others you're doubled over. If you're currently at a peak level of pain, you won't get much out of this presentation. In that case, please stop and alert your provider so he or she can get you comfortable. Severe toothache pain typically develops as a result of an infection in the tooth. The infection is called an abscess.
Here are a few common reasons the pulp can become infected.
Oftentimes, a tooth's predisposing condition has been around for months or years before the tooth actually develops the painful infection. Of course, we like to address the predisposing condition before it causes that horrible toothache. But life finds so many ways to distract us, and dental care can end up on the back burner. Unfortunately, we can never predict the day a toothache will blow up on us. The reason that toothaches can be so painful is because the infection has escaped the confines of the tooth and caused inflammation to all the surrounding tissues. Even very slight pressure can be unbearable. And if that weren't enough, for some of you whose pulps are at least partially alive, the infection makes your pulp inflamed and want to swell, but it has no place to expand. So the distressed pulp builds up internal pressure, becomes hypersensitive and extremely painful to any stimulus, such as hot or cold. Now that you have a pretty good handle on why your tooth is hurting so much, let's talk solutions. This presentation is intended for those whose tooth at least appears to be repairable, so I will assume yours is. It's important to know what is required to ultimately fix the tooth in order to help you choose the best short-term solution today. To repair the tooth, it will need at least 3 procedures: a root canal, a buildup, and a crown. A root canal involves removing the infected pulp and nerve tissue, then cleaning and shaping the empty canal space, and finally placing a rubbery material called gutta percha in the canal space to seal it shut. So the root canal takes care of the root. Now we need to clean the top part of the tooth and replace the diseased or damaged tooth structure with a filling. After that is done, the tooth is healthy again and no longer a source of infection, but it's still very vulnerable to fracture. So the tooth is prepared for a crown. The crown also offers a better seal on the top of the tooth than a filling would. It helps keep the bacteria out. Here are real-life examples of repaired teeth as they show up on an X-ray. Now that you know what is ultimately required to repair your tooth, let's review what we can do to relieve your pain now. Today we have 3 options. Option 1 is prescriptions only. An antibiotic will relieve the infection that is surrounding the tooth. It typically takes 2 to 3 days on antibiotics before you will really notice relief. While you're waiting, you can take a pain reliever. Antibiotics are a short-term solution. Please note, antibiotics will never, ever cure a tooth infection. It would certainly make life easier if they would. Unfortunately, antibiotics cannot penetrate the source of the infection, which is the pulp of the tooth. So if you choose this option, you'll need to revisit this tooth within a couple of weeks. Antibiotics are the only option if you have significant swelling, the kind a stranger would notice. The external swelling must be reduced before work is feasible. The next 2 options I present may depend on time constraints imposed by today's schedule and whether or not they fall within the scope of treatment your provider offers. In some cases, you may need a specialist referral. Option 2 is prescriptions plus a procedure called a pulp debridement. A pulp debridement is the early stage of the root canal procedure, but make no mistake, it's not the actual root canal. In this procedure, we remove as much of the pulp tissue as we can. Then we flush the area with disinfectants and place a temporary filling. This pulp debridement procedure can be done fairly quickly. It may seem like the root canal, but the full cleaning and shaping and fitting of the root canal takes significantly more time. The advantage of the pulp debridement is that the nerve of the tooth will be removed, so you won't be bothered by stimuli such as hot or cold. The disinfectants used inside the tooth will work along with the antibiotics to attack the infection a little more quickly. And the pulp debridement may buy a little more time before you need to get back to the tooth for definitive treatment. I usually advise my patients to seek definitive treatment within a month or so. Option 3 is removing your tooth. Of course, tooth removal is definitive treatment for your infection. It may be a very tempting option for some people who want to be done with this darn tooth. But when you think about it, this toothache chapter of your life will be short, relatively speaking, while tooth loss and its effects can last a lifetime. There are quite a few consequences to tooth loss, including unhelpful shifting of teeth. Yes, we do have fantastic tooth replacement options, such as dental implants or bridges, but these procedures are typically more expensive than fixing the tooth. As a final consideration, before making a decision on what you'd like to do about your tooth, it's often helpful to do a full exam if you haven't already done so. It may or may not make sense to repair a tooth depending on your current state of dental health. It's best to develop a strategic approach to your overall care so that we can achieve the best outcome your dental budget allows. Let's go through a quick review of your 3 options for today. Option 1, just prescriptions. Option 2, the pulp debridement. The nerve will be gone and you might get a little more time out of that. Option 3, remove the tooth. Whatever you do, please take care of it one way or another. Tooth infections can be dangerous and even life-threatening if left to fester for too long. It's not something we want to mess around with. Well, this concludes our toothache presentation. Thank you so much for watching.